Pharmaceutical solid oral dosage forms formulation, manufacturing, and patient-centric considerations delivered by Around the Skin and Pharmaceuticals. Good morning, everyone. Today we will explore the fascinating world of pharmaceutical solid oral dosage forms. These are the most commonly prescribed and consumed drug delivery systems, accounting for over 70% of all medications. As future pharmacists, understanding their formulation, manufacturing, and patient-centric considerations is critical to ensuring safe and effective therapy. By the end of this lecture, you will be able to 1. Classify and describe common solid oral dosage forms, 2. Understand the formulation and manufacturing processes involved, 3. Evaluate the advantages and limitations of each dosage form, and 4. Apply this knowledge to optimize patient counseling and medication adherence. Solid oral dosage forms can be broadly classified into 1. Tablets, which are compressed or molded units containing active pharmaceutical ingredients, APIs, and excipients. 2. Capsules, which are shells containing APIs in powder, granule, or liquid form. 3. Granules and powders, which are loose or packaged formulations for oral administration. 4. Lozenges and chewable tablets, designed for slow dissolution or mastication. And 5. Specialized dosage forms, including modified release tablets, orally disintegrating tablets, ODTs, and more. Let's start with tablets, the most common solid dosage form. Tablets are versatile and can be formulated for immediate release, delayed release, or extended release. Immediate release tablets dissolve quickly to release the drug. Enteric-coated tablets resist gastric acid and dissolve in the intestine. Extended-release tablets release the drug slowly over time. Tablets are manufactured using processes like direct compression, wet granulation, or dry granulation. Next, we have capsules, which consist of a shell, usually gelatin or vegetarian alternatives, enclosing the drug. Capsules are of 2 types. Hard gelatin capsules for solid formulations like powders or granules, and soft gelatin capsules for liquid or semi-solid formulations. Capsules are advantageous for drugs with poor compressibility or unpleasant taste. Granules and powders are less common but still important. Granules are agglomerates of powder particles, often used for pediatric or geriatric patients. Powders are fine particles that can be mixed with liquids or taken directly. These forms are particularly useful for patients who have difficulty swallowing tablets or capsules. Now let's discuss specialized dosage forms. Orally disintegrating tablets, or ODTs, dissolve rapidly in the mouth without water, making them ideal for patients with dysphagia. Chewable tablets are designed for mastication and are often used for antacids or vitamins. Modified release tablets provide controlled or targeted drug release, such as delayed release or extended release formulations. Formulating solid oral dosage forms requires careful selection of several components. First, the APIs, or active drug, must be stable and bioavailable. Excipients like binders, disintegrants, lubricants, and glidants ensure proper tablet formation and dissolution. Coatings, such as enteric or film coatings, protect the drug or modify its release. And finally, taste masking is critical for patient acceptability, especially in pediatric formulations. Manufacturing solid oral dosage forms involves several key steps. First, mixing, where APIs and excipients are blended uniformly. Next, granulation, where powders are agglomerated to improve flow and compressibility. Then compression, where granules are compressed into tablets using a tablet press. After that, coating, where tablets may be coated for protection, taste masking, or modified release. And lastly, packaging, where tablets or capsules are packaged in blister packs or bottles to ensure stability and patient compliance. Quality control is essential to ensure the safety and efficacy of solid oral dosage forms. Key tests include 1. Appearance, the color, texture, and feel of the tablet. 2. Weight variation ensures uniformity in tablet weight. 3. Dissolution testing measures the rate and extent of drug release. 4. Hardness and friability assesses mechanical strength. 5. Content uniformity ensures each dose contains the correct amount of API. 6. Disintegration measures the time required to break or disintegrate the tablet in media such as water or 0.1 normal hydrochloric acid. And 7. Friability percentage loss due to loss of the mass, due to physical impact or attrition during transport of the tablet. As pharmacists, we must consider the patient's needs when recommending solid oral dosage forms. Factors to consider include 1. Swallowing difficulty, orally disintegrating tablets or liquids may be preferred. 2. Dosing frequency, extended release formulations improve adherence. 3. Taste and palatability, critical for pediatric and geriatric patients. 4. Storage and stability ensure patients store medications properly to maintain efficacy. Let's apply this knowledge to a case study. A 65-year-old patient with arthritis has difficulty swallowing tablets. What alternative dosage form would you recommend? Option 1, orally disintegrating tablet. Option 2, liquid formulation. Option 3, chewable tablet. Discuss with your neighbor and share your thoughts. In conclusion, solid oral dosage forms are the backbone of modern pharmacotherapy. Understanding their formulation, manufacturing, and patient-centric considerations is essential for optimizing drug therapy and improving patient outcomes. As future pharmacists, you play a critical role in ensuring the safe and effective use of these medications. Thank you for your attention. Feel free to ask about any aspect of solid oral dosage forms or share your thoughts on the case study. Thank you for your participation. I hope this lecture has provided you with a solid foundation in pharmaceutical solid oral dosage forms. Good luck in your future practice as a pharmacist.